Hi, I'm Sona.
And I'm Teresa.
And we're co-founders of Neopenda, a global health startup passionate about reducing newborn mortality in developing countries. In places like Uganda, babies that are born with complications have a much poorer chance of surviving and thriving than they do in the United States. Neopenda is trying to change that. We started this project as biomedical engineering students at Columbia University. We wanted to leverage our background in engineering and healthcare to help one of the world's most vulnerable populations, critically ill newborns in developing countries. We've created a simple and low-cost vital signs monitor in the form of a baby hat.
When we visited hospitals in Uganda, we saw that a nurse in a special care baby unit can be responsible for 20 or 30 babies at a time and has no monitoring equipment to help her keep an eye on all of them. 80% of newborn deaths are from causes that are preventable and treatable. These doctors and nurses need a way to be alerted when babies are in distress so that their response time can improve. We want to deploy a technology solution that will boost the impact of a single healthcare worker in an understaffed hospital. We want to help her do her job better and save more lives.
Commonly, in a special shift, special duties are evenings and night, where I participate most. We are around 2 people in the unit, and we have gone to the extent of having 150 babies at a time. And that is what you find on the unit, but we are open to admissions from all over the country anytime. So the numbers tend to be more than us. And when you look at the international guidelines of how many babies should one nurse to be effective, they even say 2 nurses for a very sick baby, or if there are babies that are improving, should be 4 babies for somebody. But that's a nightmare. Sometimes it is 150 for you alone. It commonly encroaches on the monitoring, because by the time you start on the first baby, when you reach the last baby, you may not find the last baby surviving.
This is Neopenda. It's an early stage prototype that we're currently working on. It's a baby hat that measures heart rate, respiratory rate, blood oxygen saturation, and temperature. The vital signs from multiple newborns are wirelessly transmitted to a single tablet where a nurse is alerted of any abnormal vital signs. What makes Neopenda so unique is that it's a standalone system specifically designed for developing countries where the hospitals are extremely limited in resources. We are really excited to partner with the hospital in Kampala, Uganda, where we will implement our first pilot studies. It's the first step in bringing Neopenda's mission to life.
What we need now is $40,000 to fund our upcoming field deployment in Uganda, which includes the costs of the regulatory process, manufacturing, and hiring and training nurses to use our system. A contribution of $75 will cover 1 Neopenda device, which will be used to monitor up to 12 newborns in this 2-month study. With the data and word of mouth that will come out of this deployment, we'll be able to apply to larger grants, plan larger studies, and grow Neopenda to reach more and more newborns in need of improved care.
With innovative technologies like Neopenda, ending preventable newborn deaths is within our reach, and now is the time to act. We invite you to join us in our fight to reduce newborn mortality. Let's give all newborns the healthy life they deserve. Thank you for your support.
Thank you.